Thanks for coming. My name is Arusha Campbell-Chambers. I'm originally from St. Vincent, but I live in Montego Bay, Jamaica. And as I was saying, I'd like to thank the family at Aerolase for inviting me to share our findings with you. Essentially, we're very pleased with this laser. We did a study looking at the efficacy, safety, quality of life, and patient satisfaction with a 650 microsecond YAG laser for hair removal and pseudofolliculitis Barbae in dark skin types. Now, as we know, pseudofolliculitis Barbae is a chronic foreign body inflammatory reaction to the hair shaft, most common in dark skin types. Although PFB and unwanted hair cause significant emotional and psychosocial distress, their impact on patients' quality of life has been sparsely studied. So laser hair removal has revolutionized the treatment of these conditions. And we know that the YAG laser is the safest laser for use in dark skin types. Now, a novel 650 microsecond portable YAG laser delivers gentler treatments with no skin contact nor messy gels as compared to traditional long-pulsed YAG lasers. And this laser in particular, the 650 microsecond YAG laser, was found in previous studies to be effective and safe for hair removal. So our objectives were firstly to evaluate patients' opinions about the impact of PFB and unwanted hair on their quality of life. Additionally, we sought to evaluate the patients' opinions about the efficacy, safety, their satisfaction with this laser for hair removal and for PFB. So a questionnaire was used to conduct interviews with patients. Patients who had at least 2 treatments and who consented to participate were interviewed. Patients did not receive any rewards nor incentives for participation in the study. We got a sample of 25 out of 118 patients who were treated between 2011 and 2014 for unwanted hair and or PFB with this laser. Their Fitzpatrick skin types and their treatment data were obtained from their clinical records and recorded. So I'll go through some of the demographics that we had. We found that most patients fell between the ages of 21 to 40. Interestingly, most of the patients in this study were female. Most of the patients were type 6 skin, and I think that's very important because we know that we have to be very safe, and once we're safe in type 6, it's safe for everybody else. We sought to look at their socioeconomic status because when you're looking at quality of life, this can have an impact on it. So we wanted to check to see if there was any variation in different socioeconomic class. So we found that most of our patients describe themselves as belonging to the lower to middle socioeconomic class. Now, in terms of the sites that were treated, about 44% of them treated their beard, another 44% treated their chin only, and the rest of them treated multiple sites. In terms of the number of treatments that each patient received, about 10 of them received 3 to 5 treatments prior to the study. About 6 of them received 2 treatments, 5 of them 6 to 10 treatments, and a few of them greater than 10 treatments prior to this study. Now we know that for hair removal, the ideal interval is about 3 to 4 weeks between treatments. Just under half of our patients had that 1-month interval between treatments, and most of them had about 1 to 2 months in between treatments, and a few of them had a greater time interval. Now, I'm happy that we got to look as well at the time from their last treatment to when we did the study. And what we found was about just under half of them had actually 1 year from their last treatment to when we did the study. And most of them actually had greater than 6 months interval between their last treatment and the time of study. And this is significant because we know we're concerned about the long-term results, in particular when you're looking at hair reduction and reduction in lesions. In terms of the treatments that they were using prior to the study, about half of them were using no topical adjunctive treatments, and the rest of them were using topical corticosteroids, topical preparations including hydroquinone, topical antibiotics, topical retinoids, and or benzoyl peroxide. the topical treatments were stopped at least 3 days prior to their laser treatments. And we know that this portable 650 microsecond YAG laser was used. Clinical photographs obtained with informed consent were usually taken before treatments. Patients were given the option of pre-treatment with a topical anesthetic, but they usually opted for ice instead. Prior to treatment, the areas were cleaned with a gentle cleanser. The area was then marked with a white pencil and gently shaved if necessary. During the treatment, the entire area was covered in one pass, avoiding overlapping. Ice was used to cool sections of skin immediately pre and post laser treatments. So we'd look at the parameters. Can you hear me? Good. Initial treatments were usually started at fluences of 21 to 25 joule per centimeter squared, spot sizes of 6 millimeters, and repetition rates of 1.5 hertz. In patients with skin type 6, the maximum treatment parameters were a fluence of 28 joule per centimeter squared and a 6 millimeter diameter spot size. Patients with skin types 3 to 5 were gradually increased to a maximum of 41 joules per centimeter squared with a 5 millimeter spot size. Now, immediately post-treatment, we applied aloe vera gel, a potent topical steroid, and sunscreen. Test spot treatments were usually administered and recorded at the initial pre-laser consult and immediately after treatments in the anticipation of the possible need to increase the fluence at the next treatment. So in terms of the results, what we found was that in general, the higher the number of treatments that the patients received, the greater the extent of the reduction in PFB lesions and their perceived long-term hair reduction. So for patients who only had 2 treatments, they got mild improvement, which is to be expected. So they got about less than 25% mean reduction in PFB lesions and less than 25% long-term hair reduction. Patients who got 4 treatments got good improvement, so about 51 to 75% reduction in PFB lesions and about 26 to 50% hair reduction. Now when we got to about 6 treatments, we noted good improvement, 51 to 75% in PFB lesions and greater than 75% hair reduction. And this is what we expect in general, that we tell patients that usually after about 6 treatments, most people are very happy. I do not like to promote laser as necessarily permanent because there are a lot of, as you see, a lot of these patients were female, and with that hormonal impact as well, we look at laser as a great long-term option for managing these problems. So after about 6 treatments, they may need maintenance treatments thereafter, and this varies tremendously with the individual. Some of them, it may take about, say every few months. Some of them may not even need a top-up for a year or so. So they find it the best thing since sliced bread for dealing with unwanted hair. And then we know that in patients who required more like about 11 treatments, they got fabulous improvement, greater than 75% reduction in the lesions and greater than 75% long-term hair reduction. Okay, so this is just one of our patients, and this was just after about 3 treatments with very modest settings, 6 millimeters and 21 joules per centimeter squared, 1 pass. Okay, so patients, what they like about this laser, they found the treatments to be very comfortable. 84% reported no side effects of laser treatments. 2 patients had some temporary irritation, so a bit of redness, and that went away within a day or so. And about 2 of them reported getting temporary dark spots. This is not really PIH, it's more of a crusting texture that usually resolves within days usually. Now, what I've personally received treatments with traditional YAG lasers and this laser, and I've given treatments as well with the traditional YAG lasers and this laser. And patients who've had both always report that it's phenomenal how much more comfortable these treatments are. And another benefit is that with traditional YAG lasers, you need to apply a gel, and the handpiece is actually applied to the skin. But we know with this Aerolase laser, it's actually held off the skin and there's no need for any gel. So the treatments are easier, quicker, and much more comfortable. Now, so we looked at the impact of these conditions on the individual's self-esteem, their daily activities, their personal relationships, and their occupation. We sought to look at this to get an idea of the impact of these conditions on their quality of life. So if you look at this self-esteem, that pale blue column, we found that most patients found that these conditions impacted their self-esteem prior to starting laser treatments. Most of them also found that their daily activities were impacted, because for women, you do not want to go around and, with unwanted hair and these razor bumps. So you spend time in dealing with the hair removal. So it really impacted their daily life. To a less extent, it impacted their personal relationships, and it hardly impacted their occupation. Now, this is interesting because in practice, I find that it's more so with men that it can impact their occupation, particularly certain groups like police, soldiers who need to be clean shaven. For individuals of darker skin types, this is a real mess to deal with, the problem of the pseudofolliculitis Barbae and so forth. So perhaps if we had more men, we may have seen a greater impact on their occupation prior to starting laser treatments. Now, so just to summarize, 60% found that their PFB lesions and or unwanted hair had a moderate to severe impact on their self-esteem before starting laser treatments. The impact of these conditions on the participants' self-esteem varied similarly across all the socioeconomic classes. And most of these patients stated that their self-esteem improved after doing laser treatments. 44% of them found that their condition had a moderate to severe impact on their daily activities before laser treatments. 52% stated that these conditions had no impact on their personal relationships. And about 32% felt that the condition had a moderate to severe impact on their personal relationships prior to starting laser treatments. And as I mentioned, 88% said that their occupation did not have an impact. These conditions did not have an impact on their occupation. So, the overwhelming majority of patients interviewed said that they would recommend the treatment to others. Overall, most patients were very satisfied with results. Pseudofolliculitis Barbae and unwanted hair had a negative impact on most of their self-esteem, their daily activities, and some of their personal relationships. These conditions can therefore negatively impact the individual's quality of life. And we also concluded that most patients experience improvement in their self-esteem and their quality of life after having had laser treatments, like I mentioned. And most of them, and the patients overwhelmingly found this laser to be safe and comfortable. Now, we know as clinicians, this is extremely important. It's very interesting that just this week, Tuesday, I was doing a regular treatment on a female for pseudofolliculitis Barbae, type 6 skin. And right after she says, "Doc, can I tell you something in private?" So I'm like, "Sure," And I asked nurse to leave. And she looks at me and there are tears in her eyes. And she says, "Doc, I may just be another patient to you, but I really had to let you to just say thank you." She said, you would not understand what my self-esteem was like before these treatments. And, she thanked me for everything I did for her, and I had to hug her. And, I said, "I'm so glad you're happy." And I told her I was coming here, so I'll share her story with you. Because, for women, there's not many things that are more demeaning than carrying a beard. So it's important that we can do so safely. Remember when lasers just got started, people said no to individuals with darker skin types. "We can't treat you." We've come such a long way, and I'm really grateful for this laser in particular because of some of the obvious benefits. I worked in the United Kingdom where we had a laser clinic and we had the big chunky lasers, and every few months or so you have a problem with the water systems, they need servicing. And I practice in Jamaica, so for me to get a laser there and then service it, bring down somebody, that's a big headache. So when I saw this laser, I said, aha, this is it. It's portable, there's no water system, and I've had it for about 4 years now. No problems, no need for servicing, and I think that speaks volumes. I'm really pleased with it, and it's easy for me to sing its praises. And for patients to be able to deliver these treatments, change their lives safely, again, that speaks volumes, because you do not want to cause problems where there are none. You do not want to be causing PIH. You know, you're getting hair loss, but you're causing more problems. So I'm very confident and very happy so far with this laser. And just to further emphasize, you know, we've shown in this study that the laser, again, is safe, convenient, and effective in treating these conditions in dark skin types. And the vast majority of patients were very satisfied and would readily recommend it to others. Just to go into a bit of the technology without getting too bogged down in it, basically, the Aerolase laser has been able to deliver a high power in a very short time frame, in a very short pulse width, 650 microseconds. Traditional YAG lasers deliver a lower power over a longer pulse width. So the result is that with the Aerolase laser, what you're effectively doing is heating the target quicker. And so there's less time to lose heat to surrounding skin, and thus you have more effective destruction of the target. And that's what you want to do. The whole principle of lasers is about getting that selective destruction. And particularly in darker skin types where there's more epidermal melanin, you do not want to be causing a problem at that level. So this technology avoids the overheating of the epidermal melanin, and so you have less pain or pigmentary risk, usually with no need for numbing, certainly with anesthetics, and no need for continuous skin cooling. But I would add that when treating especially skin types 5 and 6, I find using topical, you know, just ice in a glove, very useful. The ice packs, very useful. We do it as we go along. So right before we treat an area, we use the laser on a particular section, and right after, just for a few minutes, and it makes that much of a difference. But in fairer skin types, you really don't need to. Okay, and what I like about this laser too, I mean, if you read the literature, there are a whole host of other indications for use of it. Another indication, also in skin of color, is to treat dyschromias, and we know that this is a very, very big problem, particularly in skin of color and other skin types, because in addition to treating melasma, it can also be used to treat lentigines and other problems beautifully. Now, with melasma, we know that we need to be very cautious when treating this condition, and we need to let the patients be aware that the aim here is to control and not necessarily cure. So they have to do their part as well with sun protection and so forth. Where I think the laser is beneficial is where the topical treatments would only go so far, and you have that deeper dermal melasma that you want to reach. I think the laser can be placed here, but you need to be cautious with your settings. As you can see in this treatment with beautiful results, they used a 6mm spot size with 18 joules per centimeter squared, but did it in 3 passes. Okay, so I think lasers do have their place in treatments of melasma, but you just have to position it appropriately. Another use is acne scarring. Now we know originally we went from ablative lasers and other treatments, but nobody has the time for all that downtime when treating acne scarring. So patients want to come in, go out, and get results. With this treatment, however, and treating acne scarring in general, we need to let the patients know again that it's not a quick fix. It takes time to see these results, and you get more improvement with time. So for instance, with this laser, they were able to achieve significant improvement over 7 treatments. And I think once you are frank with your patients and they understand, okay, it's going to take a few treatments, then they're willing to accept these results. You always want to under-promise, over-deliver, right? So I find it very useful and very safe. Again, these settings are very modest, about 21 joules per centimeter square with 3 passes. And I too combine, when treating acne scarring, combine with microdermabrasion right before the laser treatment, not after. And that actually helps the laser penetrate deeper too, as well as give them a nice external smoothing of the skin. Another use is actually treating acne, and we know that's the most common thing that a lot of us see. And so it's good to have that in our armamentarium to offer another option. Not everybody wants to be on oral antibiotics and so on. So I think laser has a role here. Again, these treatment settings are very modest. 6mm spot size, 18 joules per centimeter square with 3 passes. However, you can go higher to target specific inflamed lesions. And so they get that sort of a quick fix as well as getting the gradual improvement. So I'd just like to thank you for your attention. These are two of my nurses. They're actually a mother-daughter team in Jamaica, and they make this happen. So I'd also like to acknowledge them. And thank you for your attention.